People consider bone marrow transplant and stem cell transplant to be the same thing, which is true in the sense that bone marrow is the richest source of stem cells in the human body. But research has proven that there are also other sources of stem cells in the body, such as in the blood of the body, and stem cells can be extracted from there. The umbilical cords of infants are a rich source of stem cells, and modern science has introduced that even fats contain stem cells that could be used in stem cell transplants. So now, stem cell transplant has earned its solo title thanks to all the ongoing research on stem cells in the field of regenerative medicine and can no longer be confused with a bone marrow transplant. Stem cell transplants have thus become a unique therapeutic approach to regenerative medicine, and research into stem cells has been pivotal in the advancement of regenerative treatments for many diseases. A stem cell transplant is simply a procedure in which a patient gets new stem cells from a donor. If there is a donor, this type of transplant is called allogeneic and involves either using related or unrelated donor stem cells. If there is no donor, the patient's stem cells are used in a process known as autologous transplantation. Likewise, the transplantation will be called syngeneic, which uses stem cells provided by an identical twin or cord blood, using umbilical cord blood donated after the birth of a baby. In the process of stem cell transplantation, two things are of high importance in determining whether this process is executable or not. One is the condition of the patient who is going to receive the stem cells. If the patient is not in a suitable, healthy, and safe state, then this process cannot happen. And also, the chances of acceptability are measured in allogeneic types of transplants. Plus, for donor determination, a sibling is the first priority so that the recipient's body accepts the stem cells. For those patients who do not have any siblings, their children are considered their potential donors because children of a person have half the DNA of each of their parents, so half of their acceptance of stem cells is certain, and the other half is left to the body's own accepting ability. However, for those patients who don't have any siblings or children, the only choice left is to go for an unrelated donor. Autologous and synergic transplants, even though they have their own complexities, still do not involve any donor selection complications. The aging factor is also there when it comes to the condition and suitability of the patient, but the average survival rate due to increased age is high, so in this way, age exists as a factor but is not an obstacle in most cases. Despite all the complexities and considerations that need to be taken into account when considering stem cell transplantation, it remains one of the most valuable treatments for curing a variety of diseases. A stem cell transplant has been proven to be a promising treatment to cure blood cancers. Blood cancer is a disease in which the bone marrow of the patient continues to produce malfunctioning and abnormal blood cells, which keep on multiplying, and they also halt the normal working of the healthy blood cells that are present. The process of bone marrow transplantation involves actually transplanting healthy stem cells from the bone marrow to the patient, who is suffering from blood cancer or other related diseases. A stem cell transplant involves putting healthy stem cells into the patient so that those newly received stem cells produce healthy blood cells to make the immune system of the patient normally work again. Stem cells are added to the body of the patient just like a blood transfusion, and they take the place of the old malfunctioning cells, making it possible for the immune system to recover and start functioning properly. Post-transfusion, the probation time for new stem cells to make healthy blood cells is around 1 to 2 weeks. The newly entered stem cells perform their action after replacing the patient's own bone marrow stem cells. Graft versus tumor effect is the phenomenon observed post-transfusion, when the new stem cells do more than just replace the malfunctioning old cells. It is when the new stem cells attack any remaining cancerous cells in the body, so as to strengthen the patient's immune system against further possible attacks. This happens due to the remarkable healing ability of the stem cells as they produce white blood cells in addition to the red blood cells in the body, and those white blood cells attack and make sure no cancer is left in the body. The scope of stem cell transplantation in the field of treating diseases is so high and promising that many scientists are now starting to investigate its applications in treating more common chronic conditions, such as Parkinson's and Alzheimer's diseases. In conclusion, Stem cell transplantation is a groundbreaking procedure with high potential for treating many different diseases, from cancer to chronic conditions. The introduction of stem cell transplants has revolutionized the way we approach and treat diseases. And all this is because of the remarkable natural healing ability of stem cells that has left other drugs and other therapies behind. If you are looking for the safest, most effective cell regeneration supplements, please see the link in the description below.